Washington State needed to increase its psychiatric beds due to the number of residents living with mental illness. Washington has roughly 1.2 million residents that are living with mental illness. We've also seen an increase in requests for inpatient evaluations. Washington State requires a competency evaluation 14 days after a court order is signed, and Washington State also requires competency restoration to begin 7 days after a court order is signed. Due to the limited bed capacity at Eastern and Western State Hospital, this created a backlog. Since 2023, BHA has grown by opening up several facilities. We opened up the Oak unit on Maple Lane campus, and that unit is a 16-bed civil facility that provides mental health treatment. Later in 2023, we acquired and opened up Olympic Behavioral Health. The additional community beds support the department, meet the competency evaluation and restoration requirements, and also reduces the burden on Eastern and Western State staff.
Our treatment mall, this is the lounge, and so this is when patients come down in the morning, what they do is they get a cup of coffee and then they come and sit in the lounge and then just start their day, slowly start their day and kind of talk about what they're going to do. For Olympic Heritage, most of our patients have come from Western State, and many of those patients come from the greater King County area. And it's important for our patients to transition back to areas where they're familiar with, where there may be more resources available to them. It's been nothing but successful for our patients when they discharge to an area that they're familiar with, and again, that they may have family or loved ones in the area that can also be a support to them while they're healing in the community.
Another aspect of the development of behavioral health and treatment centers is the focus on trauma-informed care that we are trying to integrate into basically every aspect that we have, in the design of the buildings to how residents are admitted to each facility, how they experience the space, how they experience the staff, how they interact with other residents, and how they essentially engage in their own recovery.
We continue to grow in 2024. In 2024, we opened up Columbia. Columbia is a 30-bed, not guilty by reason of insanity unit, providing treatment. We continue to expand on our Maple Lane campus by opening up Cascade, and Cascade has the capacity to transfer in 30 not guilty by reason of insanity residents. With that, we still have future plans of growth. Our future plans of growth on Maple Lane campus include 5 additional units. Those additional units will bring in an additional 120 beds of civil residents. We will expand our footprint by moving down to Vancouver, Washington, where we will have the Brockman campus. The Brockman campus will consist of 3 16 civil bed units for a total of 48 residents that will also transfer out of Eastern and Western State Hospital.
We've thought outside the box to make the patient experience a different one from where they came from, but also a positive one. We've had many successes with how we care for our patients. Just continue to grow and just look forward to what the future brings for Olympic Heritage.